Greetings and welcome to this module on strategies for ensuring clinical validation and documentation. In this presentation, we will explore various aspects of clinical validation and why it matters, and how to achieve it effectively. Our focus is on providing practical insights that can be applied to your daily practice and enhance documentation quality. My name is Tony Appleberg Parks, and I am a clinical documentation expert and health administrator from the United States. And it's my pleasure to be here today for module number 8. In today's healthcare environment, accurate and thorough documentation is not just a best practice, but a necessity. The module, in this module, we're aiming to equip you with the knowledge and tools needed to ensure clinical validation in your documentation practices. Clinical validation ensures that the documented diagnoses and procedures are supported by clinical evidence. This practice is critical for several reasons. Accurate documentation reflects the true clinical picture of the patient, leading to better treatment decisions and improved patient outcomes. Clear and thorough documentation helps in reducing medical errors. Misinterpretations can occur when documentation is vague or incomplete. Proper documentation is essential for coding accuracy, which in turn impacts reimbursement and compliance. Incorrect or incomplete documentation can lead to denied claims and potential legal issues. Healthcare providers must comply with numerous regulations and standards. Accurate documentation helps ensure that these requirements are met. So we will explore best practices, common errors, and practical examples to help you improve your documentation practices. We'll start by understanding why clinical validation matters. Clinical validation is crucial because it ensures that the documented diagnoses and procedures are supported by clinical evidence. This validation process involves verifying that the documentation accurately reflects clinical conditions and the care provided. So there's a few key reasons why this matters. When documentation is first of all, enhancing patient care. When documentation is accurate and thorough, it provides a picture of the patient's health status. This information is vital for making informed clinical decisions, coordinating care, and managing chronic conditions. For instance, accurate documentation of a patient's allergies can prevent adverse drug reactions. Then there's reducing errors. Clinical validation helps reduce errors in patient care. Inaccurate or incomplete documentation can lead to misdiagnoses, inappropriate treatments, and medication errors. By ensuring that documentation is clear and supported by clinical evidence, we can minimize these risks. Also, ensuring accurate coding and billing. Proper documentation is the foundation for this. Coders rely on the information provided by clinicians to assign the correct codes for diagnoses and procedures. We cannot guess or assume. It must be documented. Accurate coding is essential for appropriate reimbursement and compliance with payer requirements. Incorrect documentation can result in denied claims, revenue loss, and potential legal issues, as we said before. It also helps us to meet compliance requirements. Healthcare providers must comply with various regulatory requirements. In the U.S., they're set by CMS, Joint Commission, and other accrediting bodies. And accurate documentation helps ensure that these standards are met and that the organization remains compliant. Also supporting quality improvement initiatives. The accuracy is essential for quality improvement efforts and provides the data needed to track patient outcomes, identify areas for improvement, and measure the impact of our interventions. So, for example, accurate documentation of patient falls can help identify patterns and implement preventive measures in that area. In summary, on this topic, clinical validation is vital for improving patient care, reducing errors, and ensuring accurate coding and billing, meeting compliance requirements, and supporting quality improvement initiatives. So if we prioritize clinical validation in our documentation practices, we can enhance the overall quality of care we provide. So let's talk about some of the key components of clinical validation. To achieve clinical validation in documentation, it's important to focus on these. It helps to ensure that the documentation accurately reflects the patient's clinical condition and the care provided. So in more detail, we'll look at accurate patient information. The first step is to ensure that all patient information is accurate and up to date, including demographic information, medical history, allergies, and current medications. Accurate patient information provides the foundation for all subsequent documentation. Also, the detailed clinical findings should be documented to provide a clear picture of the patient's condition. This includes the physical exam, findings, diagnostics, clinical observations. So for example, instead of simply noting abnormal EKG documented in the specific findings such as document the specific findings such as an ST elevation in leads 2, 3, and AVF. Each diagnosis and procedure should be supported by clinical evidence and clear rationale. This includes documenting the clinical indicators that led to the diagnosis and the reasoning behind the chosen treatment plan. So if a patient is diagnosed with pneumonia, we would document the clinical signs: fever, cough, crackles on auscultation, or the diagnostic test results, for example, chest x-ray showing infiltrates. Consistency in documentation is crucial for clinical validation. Information should be consistent across all parts of a patient's medical record, including progress notes, discharge summaries, and procedure reports. Inconsistencies can lead to confusion, misinterpretation, and errors in patient care. Documentation should be completed promptly and ideally at the point of care. Delayed documentation can result in lost details and inaccuracies. Real-time documentation ensures that all relevant information is captured accurately and is available to other healthcare providers when needed. We should also use standardized medical terminology to help ensure clarity and consistency in documentation. Avoid using abbreviations that can be misinterpreted. For example, instead of writing MS to specify multiple sclerosis or mitral stenosis, those should be written out. By focusing on these key components, we can ensure that documentation is accurate, thorough, and clinically validated. This not only improves patient care, but also supports coding accuracy and compliance. So let's take a look at an example of good documentation. In this example, we'll illustrate how detailed and specific documentation can support clinical validation and improve patient care. So our patient presents with chest pain. The EKG shows an ST elevation, troponin levels are elevated, and the diagnosis is an acute MI, myocardial infarction. And the treatment administered is aspirin and IV heparin. In this example, the documentation is clear, specific, and detailed, and this is why it's considered good documentation. The documentation starts with a clear description of the patient's presenting complaint, chest pain. This provides context for the subsequent findings and diagnoses. The EKG findings, ST elevation, and lab results, troponin levels, are elevated, are documented in detail. This provides objective evidence to support the diagnosis. A diagnosis of acute myocardial infarction is specific and based on the documented clinical findings. This ensures that there is a clear link between the patient's symptoms, diagnostic tests, and the diagnosis. The treatment provided The administered aspirin and IV heparin is clearly documented. This not only records the interventions performed, but also provides a rationale for the chosen treatment. Not only this, detailed documentation supports accurate coding and billing. Coders can easily identify the diagnosis and procedures performed, ensuring appropriate reimbursement. Without the accurate documentation, while the coder may understand what the diagnosis is, unless it's written by the provider, they cannot capture that. Clear and detailed documentation improves patient care by providing a comprehensive record that can be used by other healthcare providers involved in the patient care. So this example demonstrates how good documentation practices can enhance clinical validation, support coding accuracy, and improve patient care. By ensuring that our documentation is detailed, specific, and clear, we can provide better care for our patients. Okay, next let's examine an example of poor documentation. And this example highlights issues that can arise from vague or incomplete documentation. The patient has chest pain. The EKG is abnormal, treated for heart issue. That's the documentation. In this example, the documentation is vague and lacks the necessary details to support clinical validation. Here's why this is considered poor documentation. The documentation notes that the patient has chest pain, but it does not provide any additional context or details about the onset, duration, or characteristics of the pain. The term EKG abnormal is too vague and doesn't provide meaningful information. It does not specify the nature of the abnormality, which is crucial for making an accurate diagnosis. The phrase treated for heart issue is not a specific diagnosis. It does not provide any information about the underlying condition being treated, which can lead to confusion and misinterpretation. The documentation mentions that the patient was treated for heart issue, but does not specify what treatments were administered. This lack of detail makes it difficult to understand the patient's care plan and evaluate its effectiveness, and it also has an impact on billing and coding. Vague and incomplete documentation can lead to coding errors and denied claims. Really, it's just an inability in this case to even be able to document a diagnosis that is, useful in reporting. Coders may struggle to assign the correct codes without specific and detailed information, and generally have to go to the lowest level of specificity or very general codes, which are typically not good for reporting purposes. Poor documentation can lead to miscommunication and errors in patient care. Other healthcare providers may not have the information they need to make informed clinical decisions. So that example should illustrate the importance of being specific and thorough in documentation. Vague and incomplete documentation can lead to errors and misinterpretations and potentially harm the patient. By ensuring that our documentation is clear, detailed, and specific, we can support clinical validation and improve patient care. To ensure accurate documentation, it's important to follow certain strategies that promote clarity, specificity, and completeness, like using standardized medical terminology to help ensure clarity and consistency in documentation. We should avoid using abbreviations that can be misinterpreted, like MS, to specify multiple sclerosis or mitral stenosis, or it used to be used for morphine. I think people have generally stopped using that, but that was why it was eliminated as an option. Standard terminology reduces the risk of confusion and ensures that documentation is easily understood by all healthcare providers. Completing documentation at the point of care ensures that all relevant information is captured accurately. Real-time documentation reduces the risk of omitting important details and helps ensure that the information is up to date. Delays can lead to inaccuracies and missed information. We should document all relevant clinical indicators that support the diagnosis and plan. This would include physical exam findings, diagnostics, and clinical observations. A patient diagnosed with pneumonia should have the clinical signs documented: fever, cough, crackles on auscultation, for example, and the diagnostic test results, like chest x-ray showing infiltrates. Consistency in documentation is crucial for clinical validation. Information should be consistent on all parts of the medical record, including progress notes, discharge summaries, and procedure reports. The inconsistencies can lead to confusion, misinterpretation, and errors. Each diagnosis and procedure should be supported by clinical evidence and clear rationale. Document the clinical indicators and the reasoning behind the treatment plan. This provides a clear link between the patient's symptoms, the tests, and the diagnosis. Provide specific and detailed information. Avoid vague or ambiguous language, like, instead of writing infection, specify the type, location, and organism where possible, like a UTI caused by E. coli. Specific and detailed documentation supports clinical validation and accurate coding. Regularly review and update documentation to ensure that it remains accurate and relevant. And keep the problem list updated to reflect resolved versus current conditions, as well as the history list. Like we've discussed in the past, the proper use of history of, the terminology history of. Ensure that follow-up plans are documented and any changes in the patient's condition are recorded. By following these strategies, you can ensure that documentation is accurate, thorough, and clinically validated, not only improving patient care, but supporting coding accuracy and compliance. Some common errors in clinical documentation include vague and ambiguous language, incomplete and missing information, inconsistent documentation, late or delayed entries, copy pasting without updates, inadequate documentation of medical necessity, poor handwriting for non-EHR systems, failure to update problem lists, incorrect use of abbreviations, missing documentation of patient education, lack of follow-up documentation, incomplete procedure notes, inaccurate documentation of medical administration, lack of documentation for changes in patient condition. Those are just some of the things. And you'll receive a document that will give you a little more detail on that also. And last but not least, it's important to realize that continuous education is vital for maintaining high standards in clinical documentation. Providers must stay informed not only about best practices and coding guidelines, but compliance requirements. We all know healthcare is ever evolving, so in order to stay up to date, we need to be aware of those changes, the constantly changing coding guidelines, compliance requirements. We need regular training sessions on documentation best practices to help improve the quality of documentation. We need to understand how it impacts patient care. So continuous education contributes to your professional development and growth. So continuous education also provides opportunities for feedback on documentation practices and helps you to identify areas for improvement and implement the necessary changes. We can utilize technology in this case. It does play a significant role in clinical documentation, and we will talk more about the latest tools in another module. But just as a high-level overview to touch on that, we have electronic health record systems. There are templates and prompts available standard terminology in the EHR systems, they allow for real-time documentation. You also have available to you clinical decision support tools, which help identify clinical indicators, provide best practice guidelines, and enhance medication safety. And then with AI, we have the natural language processing. We will also get more into that in another module. But it helps identify documentation gaps, improve documentation accuracy, and helps to support coding and billing. And then there's also the continuous monitoring and audit tools, which help with conducting regular audits, identifying areas for improvement, and providing feedback. So by utilizing these tools and technology, healthcare providers can enhance the accuracy and efficiency of their documentation and support clinical validation and improve patient care. So we will talk more about those later. And just to conclude, ensuring clinical validation and documentation is vital for patient care, accurate coding, and compliance. By following best practices and using available tools, healthcare providers can improve documentation quality and reduce errors. So here is my contact information. I'd like to thank you for your attention and commitment to improving clinical documentation practices. Together we can achieve excellence in clinical documentation and ensure that our patients receive the highest quality of care. You're welcome to reach out to me by email with any comments, questions, or otherwise, and also you may wish to do so by leaving comments in the chat. Thanks so much for your time and for joining me today, and I'll see you in the next module.